I think the lefty is not in here yet. Dr. Todd is a lefty and Dr. Jason's a righty, so we're very used to going back and forth from right to left. And then this easily can just get pulled down, and then the mega tub gets moved over. So you just have to move this over and then switch this around, and I'll show you it. There's a video on YouTube of me moving it from right to left.
And this is kind of neat.
We take pictures of everything so that anyone can come in and help out, whether they're brand new.
That's how McDonald's makes hamburgers across the United States. Right? They get to train 17-year-olds to make hamburger in Hayes, Kansas, or Reno, Nevada.
And then back here, these are all customized for your office. It's primarily for barriers and hygiene products so that they can make the bags right here. We don't even use bags, we just give them whatever we're giving them that day, because if you're pre-making bags, then you're wasting someone's time all day long making bags, and half the time the patients don't even want half of what's in there. So you're wasting money all around. So now they just ask, do you want floss? Is there anything that you want? And then they just get the one thing. And a lot don't want anything. You're gonna see two different workstations. This one is for the Manhattan room, but the one next door, this is attached to it. This is a consumable bin, so everything that gets thrown away is in here, and every single room looks exactly the same, both the mega tub and the consumable bin. And then this is for your sharps, so that it's away from the patients, they don't see it. Our light cure is attached, which we don't ever have a problem with it being attached, and it's 2-second cure, so it's really quick. And then all of these can be interchanged and moved around based upon whatever you guys do. Some offices use 2 air waters, we only use 1 because we feel like it's more efficient for the assistant to know when to hand it to the doctor, and the doctor isn't constantly taking it, putting it down. Yeah.
When do these how do these get filled?
These are stocked once a week. So they just take the whole thing out, take it into sterilization. When you see sterilization, you'll see how easy everything is to access. And then they just bring it right back. Mm-hmm.
Who wants to sit down?
Yeah, who wants to sit in the chair?
I'd recommend it.
It's so comfortable. It has heat and massage.
Ready?
You're going to sit in my chair?
There's heat and massage. I recommend trying both of those.
Oh my goodness.
I'm the right-handed dentist in here. Here's your chair.
You want to sit?
This feels awesome.
I'm going to lean you back.
Everybody says the same thing. It's crazy. We were so adamant against the heat and massage. I was like, no, I'm not doing it. And then they showed up and they all had heat and massage because Dr. A was smarter than me.
Put my head back.
You can push it back. I'm actually good at
heat massage. And I'm like,
The headrest adjustment.
It's multi-way articulating, so it can go way far back. It can go all the way down there. If you have like a little old lady and she's too short to get up there, you can move it. Or if you have
those little
a really tall guy, you can pull it even farther. So
That's awesome.
is that good?
Oh my gosh, yes. You can take a nap. I think you guys should try it.
And then the doctor, you're like, give me a turn.
I know, right? I'm falling asleep. He's like, this isn't ready.
The doctor and the assistant chair are also multi-moving, so obviously it goes up and down. But it also, the back can go towards me, or I can push it back. And then the seat also rotates if I want to sit farther back or if I want to be more up front. Uh-huh, yeah.
So who's an assistant here?
Oh my goodness.
Is there an assistant?
Assistant, any assistants here?
You?
Okay, so notice the lack of a belly bar.
There's,
Okay, great.
yeah,
Makes it
that's
easy.
perfect.
Usually that's the thing that
Yeah.
freaks out folks.
I
It's
mean-
yeah, okay, yeah, there you go.
I love
So-
to tell the story that when I was in the other office and we had a belly bar, I saw a chiropractor once a month, and he would tell, Dr. Jason's righty, Dr. Todd's left, he would say, you've been working with one doctor too much, you need to work with the other one and rotate, because I'd be like this.
Oh my goodness.
Over to the side, and he's like, you need to get over to the other side. And then when we came over here, I sit very straight all the time, whether I'm with Dr. Jason or Dr. Todd, and I never had to go back. And he would say, what are you doing differently, because you're aligned, you're not a wreck? I said, well, we got new stuff at our office, and I sit very straight now. If you have a taller doctor, you can go higher
This is actually.
so that your feet are on
I
here
think
or
this
on
one
here.
Is, actual floating floor.
It's
all
on the other side.
Oh, my.
If you go this way and then kind of lift
It's
up,
commercial grade.
it'll go up. Yeah, there you go.
The warmth is good. That would eliminate maybe some washing blankets.
Can you simulate, I'm trying to envision how you can see number 18.
So I wait for the doctor to get adjusted to where he wants the patient and himself, and then I adjust to that. So you are very close, and my leg is in between his leg, and I am this close to the patient. But there's this armrest right here, so my leg isn't touching your arm. And even if they are bigger, we have this in between us, so they don't even really notice. And I can see everything that I need to see, and so can he. This is for the doctor, and this is for the doctor, and nothing else is for the doctor. This is mine, and if you want anything, I either know it or you tell me. Yeah, you will get karate chopped if you reach over here. Yeah, if you're gonna take the mirror, we believe it's the assistant's job to know when you want the mirror, when you want each instrument, and if it varies, if you change it, then you just tell us and we do it. Instead of Dr. Todd putting the mirror over there, and then he's asking me for the mirror, and I'm like, I don't know where it is. Yeah.
And there are YouTube videos on that use that will be the slowest minute and a half of. I produced at somewhere around $1,600 an hour, and the videos you watch on YouTube, I'm producing at $1,600 an hour. It doesn't have to be stressful.
I feel like
go ahead and do
I
this.
feel like the visit should be like, my goal of the visit is I tell the patient, this is work, we're gonna do our thing, and just let me know if you need anything. Heather's in charge of the patient, but Lily, my goal is to not talk. This is not my show. I put on a little show today, but when I'm in that spot, I'm just like, hey, it's go time, and I'm like, and we just
Yeah, it's not
do,
social hour for us.
and I'm not, Heather knows where I'm at, so the dance should be that way. I know that it sounds normal to all of us, but we do have our weird quirks, so if you actually did film yourself, you'd be like, okay, let's eliminate that, this, do more of that, do less of this, and then you become more efficient.
And with the one, people ask a lot, like, how do you hand it to him to use? I put my pinky on there and I hand it. Do you want to grab it? And so I'm holding it so it's not completely over the top of her, and then I just take it back.
And over the patient handpieces are fine if you really don't treat apprehensive folks. They're fine. It's not a big deal. Like, there are dentists that go ahead and do this and put the handpiece over there. Now, we've done time studies. It is 0 minutes more productive. No difference. 7% of a procedure is handpiece time. The total lapse time of a doctor is 7%. And so it's fine. It's just you spend a little more money, and don't try to do consults in those rooms because you're sitting with the patient up and you're talking to the patient about future treatment, and there's a bunch of drills facing them.
Yeah.
Which we don't, that doesn't bother us. It kind of affects the buying decision of the patient. Yeah. So that's just the decision. Just don't do consults in those rooms if you're going to do that.
The thought to it is when you just walk in, though, like when we go down the hallway and you look at the next ones, if you're put on your patient glasses, you'd walk in, you'd be like, there's nothing really to see here except for a window and a chair.
Yeah. All the scary stuff is back there, behind the patient where they can't see it. Mm-hmm. Did you want to say her? Sure.
Does anybody else want to try the heat chair?
Do you want to try? Yeah, you can just push.
Does the heat just stay on?
When
It goes off on its own.
Oh, it does.
It does. So does the massage. Someone else
just-
want to sit?
Forget the
Anyone?
200 other
Anyone?
channels.
It is a very complicated system.
When we made the first of the heated massage chairs, we do a lot of sedation work, and those patients always get cold. So that was why we built that in at first. I had no idea of the significance of the marketing side of this. I mean, I built it to make it easier to not have to heat patients that were sedated. That was I didn't think any further than that. Patients talk more to their friends about the chair than they do about all the care. They don't know about the margin. They don't know about, it's crazy. It's like,
And for us, it's really cold in the morning. We are open at 7. So when I set up a room, I preheat the chair because a lot of the times we'll ask and they say no, but I know that it's freezing cold and that they just came in from freezing. So when I have it preheated, they love it.
Yeah.
Yeah.
And this room is built bigger because we do have a dental anesthesiologist come in, and so he brings this stuff in and sets up. That's when we do our surgeries or our sedation cases, like for our pediatrics and our adult patients.
For more equipment to be in here.